Right. Okay, welcome everyone to our quarterly DFCS Community Forum. My name is Nora Willis. I'm in the Director's Office at DFCS, and we're pleased to have you join us today. We're going to do some reminders before we get started. I did turn on the recording. So if you prefer not to be on the recording, you can go ahead and turn your camera off. Reminder to please mute your mic unless you are speaking during questions at the end of each presentation. The presentation slide set is currently posted at the Caregiver Supports and Community Information site. This is in the email that you received. And you just need to scroll down to the Community Forums section and click on the plus for the presentation materials. We will post the recording it takes a little while to get it posted, but within a week it should be posted as long as a chat if you're putting in your questions into the Q&A. There will be time for questions at the end of each topic. If you have a question, please type them into chat, or you can hold your questions, feedback, input until it opens up for questions and unmute yourself to bring them up. Our preference is that you do use the chat so we can make sure that we collect all the questions. Okay, so here's our agenda today. We will start with an introduction, and then that will be followed by a prevention presentation by Rocio and Wendy. And then
they need to do a step.
All right, so I'm hearing some background noise. If you can make sure that you are on mute, that would be great. All right, and then we have family preservation and family engagement with Daniel and Hillary, and then we'll do a short wrap up. Okay, so with that, Dan does send his apologies. He has a last minute conflict, but he will be here at 11:30 to start the family preservation presentation. And with that, I will hand it over to Wendy for a quick introduction and welcome.
Thanks, Nora. Good morning, everyone. My name is Wendy Kanarash. I'm one of the assistant directors with Department of Family and Children's Services in Prevention and Programs. And thanks, Nora, for getting everything set up. So just a reminder to everyone, we are doing this quarterly as a way to really highlight the work that's happening within child welfare. Today, you're going to hear about the work around family preservation and family engagement across the entire continuum of child welfare. And then we're going to start to take a look at some of the work within prevention. Today's prevention will really be focused on the front end, those families that come to the attention of child welfare at the very start of the system. But we are working to make sure we look at prevention for the full continuum. So how do we work with those families to prevent them from entering child welfare and connecting them to community resources, as well as to support those families that have already come to the attention of child welfare, may have had their kids removed, caregivers that have taken guardianship or legal or adoption, and then those older youth and those families that later making sure they're not connecting back with the child welfare system. So today we're going to start to use stories to start to illustrate the services within child welfare, real stories so you can see how services are implemented, the impact to children and families. So I encourage you to take a look at what's happening and then feel free to lift up any questions. So with that, I am going to launch us off and hand it over to Rocio Abundis, who is one of our bureau managers within child welfare and heads up our work within prevention.
Thanks, Wendy. Actually, you can go to the next slide. Again, my name is Rocio. Nice to see you all again. I was here at the last meeting and had a little bit of time to talk about the Be Strong Families Parent Cafe. Didn't have a lot of time to finish up. So this is just kind of a recap about what the parent cafes are about. These are true prevention strategies intended for families who are not in the system as a way of providing them with the support and to help them build what we call their protective factors so that they have what they need to to be able to deal with life's challenges. It's all about peer support. So these are led by folks in the community, and it's a safe space for them to talk about their challenges and even victories of how to raise their families. There's no requirements for this. You don't have to have insurance or Medi-Cal. You don't have to be in the system or not in the system. The only requirement is you want to be there and you're willing to participate in the series. And don't quote me on this. I want to say it's a 6-part series. So the intent is that everyone attends. Just want to highlight that we do have a new agency that has joined the team, Culturally Coordinated Services, and they are primarily focused on serving African ancestry families. So this is a new addition. And information below is how you can get more information. Next slide. Today, we're going to put a little more focus on another prevention program. It's called Safe, Secured, and Loved Resilient Families Program. This is run by Sacred Heart. Their focus is around developing the habits of resilience. So what do you need to be resilient and also dealing with life challenges? These are also parent-led. Community members are trained to run the sessions. They practice stress management, self-compassion, self-care, anything that would help them be better nurturing parents for their children. I think the best way to tell what this program is about is really in sharing a video from one of the participants who was just part of the Resilient Families program. Learned so much from it that she then became a facilitator, but she talks about her story of how her participation in that affected her life with her children. And we're going to share that video. It's about, I think, 6 to 7 minutes long.
Me recuerdo que estaba en una mesa de aquí y llegó y se puso atrás de mí y dice, Jackie, bien cerquita, ¿no te gustaría ser promotora? Y yo le dije, no. Y dice, luego hablamos. Y le dije, no, María. Y dice, ¿por qué no? Y le digo, porque estoy aprendiendo a ser una nueva mamá, porque estoy aprendiendo a conocerme, porque estoy aprendiendo a amarme yo primero y a mis niños. Entonces ella me dice, no te preocupes, no necesitas tomar la decisión en este momento. Y cuando de repente una maestra Esmeralda fue y me dijo, ¿por qué a mi niña la están cuidando en mi salón y tú no estás asistiendo a clases los demás días? Le dije, ¿cuáles clases? Y ella dice, tenemos clases de inglés y también la niña puede estar en su saloncito. Y empecé yo a tomar el taller por 6 semanas y me enamoré, me empecé a enamorar del programa. Me di cuenta que podía salir adelante, ¿verdad? Que podía crecer, que podía aprender y al mismo tiempo me di la oportunidad de tomarme el espacio para estudiar y que mi hija estuviera aquí en la escuelita. Nunca tuve la experiencia, nunca tuve a alguien que estuviera apoyándome, diciéndome eso está bien, eso está mal. En tener la voz alta con tus hijos está bien, no lo es. Cuando yo aprendí, cuando yo llegué aquí y mi hija de 3 años me dijo, mamá, respira la flor y sopla la vela. Entonces me di cuenta que atención plena, mi hija me la vino a enseñar. Aparte de que yo estaba tomando el taller, ella fue mi mejor maestra.
En la conversación anterior, donde cuando yo la invito a que se convierta en promotora, se hizo para atrás y dijo, no pienso que puedo. Pero cuando ya empieza uno a abrirle los ojos y decirles, veo mucho potencial en ti, veo la conexión que puedes tener con los otros papás, veo todo lo que tienes que aportar para que esta comunidad siga creciendo unida, tú puedes ser parte de ese granito de arena que necesitamos.
Entonces me ganó, dije que sí. Mi madre ha sido la mejor persona que me ha enseñado a luchar por la vida. Ella siempre decía que en la vida vas a tener muchas espinas, como un rosal, pero al final de cuentas vas a encontrar esa rosa en el camino. Entonces, yo posteé en el Facebook, no voy a hacer propaganda, pero posteé. Y una amiga me dijo, Jackie, tu hija ha seguido tu eco de su voz. Y yo pensé, ¿cómo el eco de mi voz, verdad? Dice, ella está teniendo su propia voz, está haciendo la lucha, está inspirándose. Y cuando me di cuenta, sí, yo no estaba dándome cuenta porque todo el tiempo andaban conmigo, para acá, para allá, apoyándome. I told you are everywhere with us, right?
Yeah, she dragged me out even when I didn't want to. So, you know what? I guess that this is for the better. I was about like, I'd say 12, and I was dragged along with my friend. We had a sleepover that night, and we were planning on sleeping in and making breakfast together. And then my mom just told us to go to the women's march with her. And I just started to tag along with her and realized that I really enjoy helping people, and it's really nice to know that I can make a change in the world.
Y ellas han escuchado la voz en silencio de su mamá, viendo el ejemplo nada más y también el de decir, vámonos, vamos a hacer esto, ahora vamos a ir allá y ellas, ok, y después ese es el mejor ejemplo.
Being the daughter of immigrants, it gives me the firsthand experience of what it really is like, you know, when you find out this something on the news, you're like, oh, that happened, but you don't really process it until it really happens to you. And that's exactly what happened with my mom. It's like, this child could have been separated from their mother because of ICE or something like that. And it's like, my mom was an immigrant too, and that could have happened to me anytime as well.
Yo creo que cuando me tocó ir a México para ajustar mi estatus, para poder arreglar mi estado de inmigración, ella y su hermana mayor se tuvieron que quedar juntas y me escribió una carta hermosa donde ella me dijo, no te preocupes, vamos a ir al Sagrado Corazón, voy a estar con los niños, vamos a tomar el autobús de regreso a casa, vamos a preparar algo de comer, no vamos a quemar la casa. Y fue muy bonito. Yo pienso que de ahí ella empezó a crecer más. Yes.
It was a difficult time for our whole family while she was gone. So I really just got that firsthand experience of, as a daughter of an immigrant from Mexico, it just changed my entire perspective on everything. I am part of two committees. The first one is REX, which stands for Racial Equity and Community Safety. And the second one is PASOS. I actually really enjoy it now, and getting to meet new people with different experiences, getting to hear what they've been through and their challenges and their struggles and what they're proud of. It's so nice to see if I have my own voice and I have all these privileges growing up, I can use them to help other people in so many different ways. So she just taught me that my voice counts.
Thank you. I've seen this video a gazillion times and it always makes me teary-eyed because it's a story I can relate to myself. But it makes me teary-eyed because I'm so proud of Jackie. I don't know if Jackie was able to join the call. She was going to try, but she has shown so much growth and has stepped up in other leadership roles in other community situations where we're asking for community voice. And I've seen her confidence grow, and just want to emphasize the whole program is about helping children feel safe, secured, and loved, and giving the parents the skills to be resilient and to be able to support their families in the best possible way. This is the best way I could have shown it to you, was through this story. I hope you enjoyed it. And if you have any additional questions, please feel free to reach out to me. I will put my name in the chat, and then the video is available there as well. So thank you so much. I will pass it on to Wendy.
Thanks, Rocio. Did you want to talk
Sorry.
a little bit about the prevention programs?
Yes, sorry about that. Well, I don't think I have time to talk about all of them, but I believe this handout was provided to you. If not, I'll ask Nora to send it. This is a summary of the programs that are available to the community. They are all free. The only one that has some restrictions is DR, but even that is very limited restrictions. So the main thing is, if you have a need, please reach out to that information, the links that are there, and this handout will be sent to you. And as always, you can reach out to me for any services. Happy to highlight any of these in upcoming meetings, because there's always a lot of short stories to share.
Thanks, Rocio. It looks like we have a question in chat from Lydia, and she asks, is this Sacred Heart course offered in English, and is it geared to immigrant families?
Sorry, my mute. So can you hear me? Okay. It is not geared to immigrant families, but that's just the families that has tended to be connected to that program, but it's not limited to that. So anyone can participate. And so Dr. Barbara Burns is the contact person for that. You can always reach out to her to see if there's like maybe an interest group that wants to come together and form. There's always possibilities of doing that. It's just we would need to have the numbers.
Thank you, Rocio.
Thank you, Nora, for dropping the brochure in the chat. And I will put my link there as well, my email address.
Thanks, Rocio. And really want to highlight, this is one of those programs that really is about building community. So can't highlight enough the work that's happened with Sacred Heart around Safe, Secure, and Love, and the Promotores model, really highlighting those that go through the program, then empowering them to be able to give back as well, and building community within community. So a lot of love and shout out to Rocio, the team at Prevention, Barbara Burns, and all of those in the Safe, Secure, and Loved program. All right, so the other program in prevention we wanted to highlight for you today is our Flex Funds program, which is out of our emergency response program in child welfare, making sure that we are able to provide immediate support in situations where we may not be opening a case, in order to build a bridge before a family might be supported with differential response or the other community, making sure they have needs met immediately. So over the last couple years, we've seen a gap in families that might come to the attention of child welfare and having an immediate need. That immediate need could bubble up anything from food, bed, dresser, car seats is a big one for us, and immediate support around basic bills like electricity or water, clothing and uniforms for kids, and items like pest control, cleanup, or car repair, or any other tangible immediate need. Oftentimes families have access to these within community, but sometimes there's a need to connect them with resources immediately. So earlier this year, we launched a pilot program called the Flex Fund to really ease that access to be able to get services quickly to families out of emergency response. So our social worker one team support staff have been provided with what we call P cards or credit cards to be able to go out and purchase an immediate need for families. So if there is a family that doesn't have a car seat to be able to take a baby home from the hospital and doesn't have access, that could be a place where we lean in and support. If social worker goes out and encounters a family and there's really not beds for all the kids in the home, we may intervene immediately to meet that need. Not necessarily a child welfare situation for further involvement with that family, and they might get connected to those resources later, but wanting to meet those needs immediately for families. Next slide. So I want to highlight just a little bit of some of the stories we're hearing back about how this has really met an unmet need within the community in these stories of support. So in the past month, our social worker ones were able to support multiple families, and just highlighting 2 different guardianship situations where relatives had really stepped up to be able to care for family members with little notice and really needed some support to do that. So in one case, there was an uncle who really needed a car seat and a crib in order to care for his niece. His girlfriend and him were willing to step up and really wanted to support his sister making a decision about entering a substance abuse treatment program. They weren't set up to care for a baby and wanted to meet those needs. So the social worker was able to go out immediately with the uncle and his girlfriend and purchase both a car seat and a crib and other necessities in order to make sure that he was set up immediately to start providing support. This was a case in which the uncle was on a limited income, and it really would have been a stretch to be able to provide those services. And just so community members are aware, oftentimes if child welfare is intervening further, there is a reimbursement for caregivers, but oftentimes the first payments to relatives don't come until upwards of 60 days after they've taken a placement. So for many of our relatives on a limited budget, getting them immediate access and support is really critical. The other case that was highlighted and lifted up was a mom of 3 children who was really unable to work due to her youngest being in the neonatal intensive care unit, or the NICU. She was going to multiple hospital appointments with her baby, as well as other court dates. Flex funds were used to really get her necessities to really care for her baby: a bassinet, baby essentials, clothes for her other girls, groceries. And the mother was so extremely thankful because she was worried about having enough food for her daughter. She was worried about what it would mean for later, and she was worried about what that would mean to possibly have her children removed. She's now connected within the differential response within the community. She's connected with other community-based resources and is doing really well. So being able to show up and support that mom in the moment, take down the stress level for them, get the tangible needs so that she could be focused on what she needed to focus on, is really at the crux of the Flex funds. We're monitoring this program and taking a look at these unmet needs in order to then take a look at what that means for sustainability for later. Next slide. The other program, I'm just going to give you a few details on this, is our First Call for Families. We actually wanted to have greater stories told on this, so we'll be bringing First Call for Families and their team back for our January community forum in order to do a deeper dive. But just so you're aware, our First Call for Families is our partnership with Dependency Advocacy Center. It was a pilot and we just expanded in January to be able to reach more families. It's really about making sure there's legal support for families prior to any child welfare involvement and to try to avoid child welfare involvement, as well as items like our expansion will be around restraining orders and legal support for relatives as well. So when we come back in January, we will have support to be able to partner with First Call for Families and hear about their stories and some of their expansion. So we'll look forward to them coming back in January. Next slide. So Rocio and I will take any other questions on prevention before we go to the next part of our presentation.
And just wanted to say, I missed the other half of the earlier question that, yes, Safe, Secured, and Loved is offered in English as well.
We don't see any questions in chat. Do we have any questions that someone would like to bring up verbally?
I think this is the quietest I've seen from questions in our previous presentations.
This is Lily Majolo with Ascending Families LLC. We provide supervised visitation in Santa Clara County. There were questions that were submitted prior to the meeting. Perhaps we could use that time if there aren't any questions to address some of those.
Good idea. Nora, while you're potentially pulling those up, I can address a couple that have just come in chat. Pam asks, are these new programs since working more towards keeping children with families, or have they always been in place? So the Flex Funds was just launched earlier this year in March, April as a need that was coming up from staff, and really the amount of time it might take to connect a family, get a check issued to pay for something, wanting to launch immediately. So it is a fairly new service and program. Our Resilient Families or Safe, Secure, and Loved has been around for a while. Rocio, do you know when we launched that? It's been several years now, but do you have a date?
I want to say it's in its 5th year, and Parent Cafes, I believe, is in its 4th year out of 5. So we work very closely with the agencies to try to help build their ability to get funding elsewhere, sustainability. So we're getting close to that.
Thanks, Rocio. And we are looking at evaluation of the programs that have been here longer and setting up good tracking mechanisms so we know if it is impacting families. And because these are pilots, how do we shift and change in order to meet needs? Nora, were you able to pull up any of those questions that were referred to?
So Lily was the only one who had a question, but we were doing it offline. That's the, I cannot find the email. I have thousands of emails I'm trying to go through, but I sent these to the execs. Do you remember? It was, she does visitation. We had to check with procurement. I don't know what happened with that, but someone was supposed to get back to Lily with that question. With the answer.
I have not received a response. This is Lily.
Lily, do you just want to ask your question?
I'm not sure if it is the appropriate forum to do so. I'd like someone to pull up the email and follow up and make sure that my questions were addressed outside of this meeting.
Got it. We'll follow up on that, Lily.
Appreciate it.
Of course. And to Hillary's chat, yes, First Call for Families is also a newer program. We've been launching the pilot now for about a year, and based on feedback, we expanded it. It was originally only in a couple different zip code areas, so we've expanded it to go across other zip codes. Also, an additional need came up really around families needing restraining orders up front. And for those families who may have been sent over to probate court seeking guardianship situations or support. And so we've expanded the program accordingly in January or in September. And in January, we'll have them come back to talk about those expansions and highlight some stories of work they've been doing.
All right. I think that covers the questions that have been asked. I do not see Dan here yet. I assume it will be pretty quickly. So maybe what we can do is, John, let's flip to the very last slide. Let's do the wrap up real quickly so that we can have them, Hillary, and give more time to Hillary and Dan. But so the wrap up will be that we do continue to have our quarterly community forums. And as Wendy mentioned, we'll have First Call at that one. So these do happen every quarter, the second Tuesday of the month, every quarter. So January we'll start with our 2023 meeting series. We do have our continuum of learning scheduled for February 15th. So about 2 months prior, you will start seeing the flyer for registering for that next continuum. And then we do have a link that if you have any questions to the FCS Director's Office, you can put them, you can add them to this link. Okay. And I don't see Dan yet. Okay. So, Dan, are you on?
Checking with Dan, see his ETA.
Pardon?
Did you hear me?
I did not.
I said I'm checking with Dan for his ETA.
All right. Okay.
This is Lily with Ascending Families again. Who should I follow up with in the event that I do not hear back?
Lily, you can follow up myself. I'm responding to it right now. I'll put my email in chat as well, and I'm getting you connected with the right person.
Super, thank you.
Nora, Dan is on.
All right. Yes. All right, Dan.
Morning,
We are
everyone.
ready to-
Sorry.
Okay.
So I'm assuming we're ready.
Yes.
Okay. Good morning, everyone. Daniel Little, Director with DFCS. So happy to see so many people joining us. Hillary, Kerrigan, and I are going to go through this presentation. This will be a lot of information, so I'll probably go through some of it pretty quickly because I want to leave some room for questions. But again, I think Nora, you've sent out or will send out this information so people can always follow up afterwards if there's additional questions. So go ahead and go to the next slide. So I'm going to go pretty briefly over kind of what's been happening within the Department of Family and Children's Services around serving families a little bit differently than I think historically we have. First, to kind of establish what we know about family separations, where child welfare is at currently, both locally as well as nationally. Go briefly over some of the practice refinements that have happened within DFCS. Hillary will go over some of the really common case and family scenarios that we see and give an idea of kind of how we've historically worked with families and then kind of what we're doing now. And then touching on some of the prevention and evaluation. I'll probably go over that real quickly because I know that you guys already had heard a lot of good prevention stuff already. So go to the next slide. So we know that a removal is not harm-free, that the act of separating a child from their parents can create significant and lasting trauma, both for that child as well as for the family. And it doesn't matter necessarily if it's a short removal or a long time removal, that act does cause harm to children. Go next slide. We know that, again, attachment disruptions can have long-term consequences, similar to what we've seen for ACEs. The correlation between a separation and long-term health outcomes. And again, this is shown to even be true for short-term separations. Next slide. And there's a link to some studies. And again, if people are interested more, we can provide the full list. But there's now been a significant amount of work done really worldwide in areas that use foster care on long-term health impacts of children who've experienced a family separation. And it's pretty striking the significant impact to health if a child experienced some kind of a family disruption early on. Again, very similar to what we see with high ACEs scores. Next slide. And I think for our county, when we're talking about family separation, I think it's important to note who we're seeing separated more often than not than in our community. So our current population that we serve in DFCS is over 70% Hispanic. almost 10% Black. And you see the significant disproportionate share and impact of that harm that I've already described and who it's really impacting. Next slide. And then where is child welfare currently? So nationally, we've seen a dip in the number of children experiencing foster care for well over a decade. Now you start seeing some areas that have the kind of drug pandemics where you start seeing foster care numbers go up, but historically we've seen a decline. Go next slide. Then statewide in 2010, there were a little over 51,000 new cases, new children entering into foster care. And by 2020, we see that number down to a little over 35,000. So this decline in the use of foster care has been a trend that's been in place for a number of years. Next slide. We also know that 2020 created additional impacts, both to the work of DFCS as well as impacts to individuals within our community. We saw an initial significant decline in mandated reporting, which saw then a decline in the number of children called to the Child Abuse and Neglect Hotline. We also saw additional supports that were created during the pandemic, such as the eviction moratoriums, the CARES Act. We saw agencies such as First Five step up when families who were historically receiving services through kind of formal systems like DFCS were kind of cut off. You saw agencies like First Five step in and provide much more access to kind of informal community-based supports. Next slide. I've added this in here, and when I've done this presentation for other groups, I've thought it was important to ground us in the guiding principles and to show you kind of the agreements that we've made within DFCS. My ask to you all as our community partners is to consider us sharing these guiding principles as we do this work. So the principles we're working under is that children do best with their families. Family engagement is non-negotiable. Families have the tools to solve their own problems given the opportunity. And the final one is there can be no long-term safety without healing. Next slide. Next, I'm going to go through some of the practice refinements that have happened within DFCS that I feel have led to the decrease in the number of children entering in foster care. And I'll go into more detail in slides. Next slide. So the first practice refinement is the robust use of the child and family team meeting. So for those of you that aren't aware, the CFT, or the child and family team meeting, is the kind of primary intervention that child welfare has to engage families, community members, professional stakeholders in developing plans with families. The idea behind the CFT was always to have them drive case decisions. What we saw the last couple of years is the increasing use of the child and family team meeting up front, to where if our staff are identifying a safety threat, which in the past would have prompted a child to be removed, if we have time to have a staffing, that we would hold a CFT. And our facilitators would pull together our investigative staff, the family supports, to develop a family-centered safety plan. So prior to removing a child, you have that family and a CFT pulling together to hopefully develop a safety plan that's going to keep that child at home. And I think we've seen an increase in the utilization of these CFTs up front. And I think the increased impact of families being at the center of developing that safety plan. Next slide. We know that CFTs are important because family involvement in creating that plan, we know increases the likelihood of that plan success. So having that CFT up front to where it's the families team, not the DFCS team, and it's the families plan, not the DFCS plan. I think we're seeing a significant uptick in those safety plans that are developed upfront and early, where the family has helped develop and co-created and really have owned that safety plan. Next slide. The next practice refinement is our child and family practice model. Now, the CFPM is not new. The CFPM has been around for a number of years. I think the challenge for a system like DFCS has always been, and I take this from experience in other jurisdictions, taking things that are theory and then saying, how does that actually translate into a practice? And I think that over the last couple of years, we've had the opportunity to kind of slow down a little bit and say, you know, we believe strongly in the tenets of the child and family practice model and what that means, and having the family at the center of all that we do. How does that actually show up for a family? How does that look in our CFTs? How does that look in our assessments? How does that look in our court reports? So over the last couple of years, we really had an opportunity to kind of slow down and create kind of the model that we want that really aligns kind of the theory of the CFPM with the practice that we've always been doing. Slide. So again, we're really looking at the CFPM and saying, what is the intent of this and how should it look for a family? The CFPM is always focused on engaging family to keep children safe. It's always focused on working on strengths versus deficits. And it's really always focused on listening to needs and strengths as opposed to kind of imposing our own mandates. One of the things that really that was unique over the last couple of years was COVID. You can go to the next slide. COVID, I think, actually gave us an opportunity to slow down because we saw a decrease in workload across the department. So we were able to actually kind of take time to really look at some of the initiatives we had in place and say, how can we refine? The third practice refinement is structured decision making. So SDM is the statewide child welfare assessment model. There are a number of assessment tools. We've listed them out here. And much like the CFPM, you know, this is something that was rolled out in 2016, 2017. And we never really had the luxury to stop, to pause and see, you know, how did implementation go? It's something that has been kind of the bane of child welfare forever, and that we have new initiatives and we have to kind of create the plane as we're flying it. I think the last couple of years, we were actually able to slow down and say, you know, what are we doing? How does this align with our vision? How do we really make sure that that this supports the work that our social workers need to do and supports the child and family model? I did want to note that I've received questions on the number of children who are being served in home versus out of home, and asked if there's a way that through SDM we can kind of modify or do something with the safety assessment that would allow us to keep those kids at home. The safety assessment that we do through SDM is what helps determine if a child should be served out of home or if we can serve that child in the home. The safety assessment determines really, is there a safety threat present or not? And if there's a safety threat, can we safety plan? And I wanted to just highlight that there's no option to override that. Either we see a safety threat or we don't. If we see a safety threat, the only option at that point is to either try to do a safety plan. And if we can do a safety plan, then we can work with that family in the home. If the safety threat is such that we can't develop a safety plan, then the recommendation is for removal. You know, going back to the initial section, because we know of the significant impact of that separation, when we get to that decision point, we really want to make sure that we've exhausted all other options, which is why this really aligns with SDM. That's what SDM asks us to do as well, is before we get to that recommendation of removal, have we done everything possible to try to safety plan to control that safety threat? If not, then we are having to look at a removal, knowing the risk and the impact of that youth, but also knowing that we've done everything we can to that point to prevent, and that's our last option. On the next slide. The last practice refinement was really just kind of increasing the support for leadership, as well as the oversight of the decision-making process. So, you know, ensuring consistency in decision-making. That's one of the tenets of structured decision-making, is consistency from staff to staff. Collectively reviewing and supporting. So, you know, developing a process by which we can randomly kind of screen and pull some of these decisions and have a second look to make sure that we're doing everything right, that we're following the tenets of SDM, that we're following the child and family practice model. That the decisions we're making are based on both what's considered best practice, what's considered statute, and that we're coming to the right decisions. You know, we do all of this because we recognize the long-term emotional impact of a family separation. Again, we want to make sure that we reach the right decision based on the evidence. Next slide. And now I'm going to turn this over to Hillary Kerrigan. I'm very happy to have join us to walk through some of the common scenarios, and I think really drive home what the actual change in practice looks like for both DFCS staff as well as the children and families that we serve.
Thank you, Daniel. And hello, everyone. I see lots of familiar faces, but for those of you who don't know me, I lead the Child and Family Protection team in the County Counsel's Office. So my team is in court on all the child abuse and neglect cases that come into court. And also, which is really relevant to this conversation, we write all the petitions and we support all the warrants that go to court. So we see every removal that happens, and we also get to see all the amazing work that's been being done on a case-by-case basis to support children in their homes. So we put together these examples of what we typically see. So let's go on to the very first one. Okay, so the first example is when we have a situation where both parents have been arrested or are in law enforcement custody for reasons that are not related to child safety. We'll see maybe a parents get picked up on an outstanding warrant, that kind of thing. And law enforcement will place the children in the home into protective custody because there's nobody available in the home to care for the child. Traditionally, we would see that child would be removed from the family, place the child in foster care, and petition the juvenile court to open a court case for that child. As the court case went along, DFCS would be searching for relatives and assessing those relatives under the resource family approval standards. And if the relative could be approved, which sometimes they were and sometimes they were not, then eventually the child would be moved to the relative care after some period of time. And the parents would often receive family reunification services. These days, when we have this same scenario and we see a child taken into custody, the emergency response social worker who is responding immediately is communicating with law enforcement, with the parents if they're still on site, often with the jail if the parents have already been taken to the jail, to determine if that parent can make a plan for the care of their child while they're unavailable. And then the social worker can help facilitate that plan if the parent can make that plan. Okay, number two. Okay, number two is where we see a child suffering abuse or neglect at the hands of one parent, and that a child's other parent is not living in the home and is not offending. Traditionally, we would often see that child removed from the abusive or neglectful parent, and the child would be placed in foster care while DFCS petitioned the court and began to search for the other parent. If the other parent was located, there would be an assessment of that parent, and then the child might be released to that other parent several weeks later. But often we also saw allegations that other parent should have been aware of what was going on in the primary parent's home, and thus the child wouldn't be released to them and the child would be kept in foster care. And these days, we are seeing those emergency response social workers immediately begin looking for the other parent before we get to the point where we're taking the case to court, doing assessments of that other parent. And if that other parent is appropriate, the child does not need to enter foster care and was released immediately to that parent. And then DFCS has a host of supports that can be provided either in the community or by opening a case, depending on what the tools are showing is appropriate. Also, Wendy talked earlier about the First Call for Families program, and that program has been really great in supporting these parents, these non-offending parents, in getting the orders that they need in order to protect the child. Okay, number three. Number three is very common. 80% of the cases that have come into court historically have involved a parent with a substance abuse disorder that's affecting their ability to safely care for their child. Traditionally, those children would be removed and placed in foster care. We'd petition the court and maybe have an FR case. Nowadays, we're seeing those child and family team meetings Daniel was talking about happen right away. All the relatives and natural supports come in, and the family is often able to come up with a plan, such as grandma will take care of the kids while mom goes into inpatient treatment for her disorder, this kind of plan. And if there is such a plan reached, then DFCS is providing supports to ensure the success of that plan. Number 4. This is where we're seeing a child that has significant behavioral health needs, and the parent is really struggling to meet that child's needs. This is mostly sort of older youth, but also sometimes we have younger youth with these issues. Traditionally, DFCS was compelled to petition the court because the dependency system was a condition for eligibility for many of the services that family needed, most significantly wraparound services. We've seen a real commitment on the part of the county in recent years to remove the barriers to services so that families don't need to come into the formal child welfare system just to obtain the services that they need to care for their children safely. Okay, number 5. And this is the last one I'm going to talk about. This is where a parent's whereabouts are unknown. So the child has no parent that is anywhere that we can locate, and there's an appropriate relative caring for the child. They've been doing that for a long period of time. They want to continue providing for this child. Traditionally, we would be petitioning the court in many of these circumstances because the child did not have a legal caretaker. And then sadly, in those situations, those children would sometimes go into foster care while their relative was undergoing the approval process, or in some cases, even before January 1st, when the law changed, making it easier to approve relatives, those relatives couldn't be approved at all. So the child never got to remain with that relative. These days, we are seeing supports in place right away for those relatives. First Call for Families is really great, the Catholic Charities Kinship Resource Center, and they can support those relatives in getting the legal documentation in place that they need in order to safely maintain that child and get them the things that they need, like school attendance, medical care, and that kind of thing. And those are the 5 scenarios.
Thank you, Hillary. And again, I think you've heard of some of the prevention continuum, and I think there's amazing work that continues. What I wanted to point out here is, you know, for the purposes of this discussion, the prevention continuum really serves 2 purposes. One is just that primary prevention piece, you know, ensuring that that we're not seeing children experience traumatic events. The second piece, though, is when I went back to the purpose of that safety assessment and said that, you know, the only reason we should be seeing a removal is if we can't develop a safety plan. The expansion of our prevention services, I think, has offered additional tool set to staff to bring to those CFTs to help develop those more innovative safety plans that they maybe didn't have access to in prior years. So again, I think that prevention continuum does a couple of different things. Next slide. And then finally, just, you know, making sure that whenever we see kind of significant changes in our outcomes, that we're evaluating and saying, are we still accomplishing what we need to do? So we're establishing an internal process to review situations where we've potentially avoided a removal. Again, just to make sure that we have everything in order, that we've done all of the process correctly, and that we're seeing the right outcomes. There is a reoccurrence of maltreatment data that the state publishes. It's a federal outcome. And something that we're watching very closely. So, you know, if we're serving, in theory, more children in the home that have experienced potentially abuse or neglect, we want to make sure that by serving them in the home versus foster care, that we're seeing that maltreatment data continue to drop. So continuing to see a decrease in the number of children that experience a repeat maltreatment incident. Partnering with other jurisdictions, working with consultants such as Kevin Campbell around family finding. So just a lot of things that we're doing to continue to grow and expand the work that we're doing and kind of re-envision what child welfare really looks like. Next slide. Again, I just wanted to drive home that these are the guiding principles that we've put together for DFCS. And I would really invite all of our stakeholders to say, how can we all as a community embrace these principles, the understanding and agreement that children are going to do best with their families. Family engagement is non-negotiable. That families do have the tools to solve their own problems, as long as they're given the opportunity. And finally, there's no ability to have long-term safety without some kind of healing occurring within that family. I think that's it. So I know we have just a few minutes, so I may not have time for a lot of questions. I would open it up that you guys should all have my contact information, my email. If there's questions that come up that you want to ask, please feel free to send them directly to me, and I'll try to get back to you as quickly as possible.
We have one question in chat. Ayana asked, by chance, is there a CFT GV scenario?
Yeah, and I think that in trying to come up with these 5 scenarios, there are certainly a lot of variations and a lot of sort of the general concepts that fit into those 5 scenarios can sometimes involve domestic violence. For instance, when we have the one parent who can protect from the other parent, or we have the child and family team meetings where safety plans are developed, that will often be due to concerns around domestic violence. So I think that there are a lot of different ways that these actually go, and there is an oversimplification in the 5 examples, but you're certainly right that those are issues we see great work happening around.
Right, and there's a question from Mary about the best way to see outcome measures. There are actually, Nora, if we can send out the link to the Berkeley site, there is a public facing site where you can scroll by our county. I think the repeat maltreatment is probably the primary outcome measure. I mean, we're going to be looking at, removal rates. We're looking at disproportionality. So those are all the other categories we're going to be looking at. We have child and family team meeting data that we track on, how many natural supports are we inviting. So those are all things that we're going to be looking at internally. I would say that the maltreatment data is probably the kind of primary formal federal measure that we're going to be tracking. Sarah asked about the evaluation partnerships. So that's a very good question. We are actually looking at working with Casey Family Programs to see if they can do a full kind of outcome evaluation. So we're kind of early in discussions with them, but I know they're very interested in looking at this. Hillary and I did actually have an opportunity to present some of this information to a statewide Children's Permanency Council. So I know that there's some interest in other statewide groups to kind of say, what is actually happening and how can we look at the outcomes? But I think the first piece is with that Casey. I think that they're going to come in and see if we can do some kind of a formal evaluation. Question about family engagement, non-negotiable. What happens when the unsafe parent refuses service or accepts some but doesn't follow through? So that's a really good question. So when I say family engagement is non-negotiable, that means our efforts to engage and keep people engaged is non-negotiable. There may be people that opt out, individuals that opt out, but from our side, I'll speak for DFCS, we're going to continue to attempt, and we're going to continue to attempt to locate additional relatives, additional supports for that family. What I want to avoid is something that when I was a case carrying social worker, was pretty common, this whole idea of apples falling far from trees, and the idea that we could eliminate whole swaths of kind of natural supports because we felt like that they were either bad or unsupportive or something. What I want to make sure is that we're not eliminating supports from families. We're going to, through our engagement, identify things, individuals that may not be a good support for a certain activity, but could be a good support for another activity. We could identify relatives who aren't able to be a placement support, but are able to do other kind of supports. And we may have people that are unsafe. And then, the engagement and their role within the scenario may be a little bit different. We just don't want to stop trying to engage in building that circle of support for that family.
Dan, one
All
other
right.
myth. Dan, one other myth I would put in this place is that the assessment is ongoing. So safety planning with a family is meant to be short-term out in the field. And then the family comes within 72 hours and has a child and family team meeting, either to establish greater safety, or sometimes safety can't be continued and maintained with a family. So I would just highlight assessment is ongoing for a family as circumstances change, but it's as Dan indicated that we need to engage with family and have them part of the solution, part of solving their own challenges, their own problems, and getting them to the table.
Thanks, Wendy. I see one hand up. If we can do a quick question and then we can wrap it up, I think.
Yes, thank you guys. Thanks, Daniel. I appreciate that. My question is, when will we hear back the results and kind of outcomes from the survey or the assessment that you guys are making with Casey, and how can potential organizations be involved in that as well?
That's a really good question. We have our initial discussion with Casey coming up specifically about this. I will bring that up with them. What I would hope that we can do is, the last time we did a study with Casey was around our reduction in kids in group home, and Casey actually published a national study results. That's my ask to them, is that whatever they're creating would be available nationally. So once we got a final product, we for sure would send that out to all of our stakeholders that we have on our distribution list. Let me also ask them about involvement of our community partners and those with lived experience, CBOs, other county departments that may want to participate in this too as well. And then we can, if there's an opportunity for that, which I'm assuming there will be, then we can send that out as well.
Thank you.
Yeah, you're welcome. Thanks for the question. All right. Kept everybody over a couple minutes, but I hope that this has been worthwhile, and really do appreciate seeing so many people join. Again, Nora had the information available for everybody. If there are additional questions, please feel free to reach out. And look forward to seeing everybody in January for this, and then in February for that continuum learning. So, all right, thanks everyone.